we have a truly inspiring guest with us, someone who's making big strides in women's healthcare. Please join me in welcoming Tara Raffi, the founder and CEO of Almond. Almond is reimagining the way ObGyn care is delivered, aiming to solve a very real and personal problem that many women face. Tara, I'm so happy to have you here with us today. I'd love for you to start with your origin story, how you went from consulting and tech at McKinsey to launching Almond. I understand that there was something that happened in the Bay Area that was like the catalyst for you to start Almond.
Yes, well, thank you so much for having me. It's a joy to be here. And the story for how Almond came about is, I started my career as a consultant at McKinsey & Company and served a number of different clients, and then ended up taking an easy project at a hospital system because I wanted a break from these financial, 18 hours a day. And I'd always said I never want to be a doctor. I never want to work in healthcare. Both my sisters are doctors. And I ended up on this project, and it changed everything for me. And I just instantly fell in love with healthcare. And really what changed the way that I was thinking about healthcare was I'd seen the way that so many companies work internally and helped them solve these problems. And then I went to work in healthcare, and the types of problems that we were solving were like 20 years before, 20 years in the past, it felt like. And on something that is so important, so critical to our lives, which is our health. And on top of that, being a woman, it just, where we are and where we need to be, where we should be, where we deserve to be is huge. In particular, because as working women, we are now spending more and more time in the office, focused on the promotion and on balancing work and life. And we have this really serious healthcare need, which is managing pregnancy, preparing our reproductive health, and then going through a pregnancy, which is a bigger lift earlier in life. So we can't do it all. Something's got to give. If we have this major healthcare need and we're working more, we need to address some of the big problems that are coming up for us in our healthcare. And, I could go on, but I won't about all those gaps. I was just seeing it in my life and my friends' lives that we weren't getting the healthcare that we needed as women. And so decided to leave McKinsey and start Almond.
You also share in your bio that there's a maternal health crisis that's happening in the U.S. Tell us a little bit more about that.
Yes. So I'll start with the numbers because the numbers are very clear. 75% of women are dissatisfied with their ObGyn care. That is across full scope obstetric, pregnancy care, and also general reproductive health. And in particular in maternity care, we have the highest maternal mortality rate amongst all developed economies in the U.S. We have 10% of newborns ending up in the neonatal intensive care unit. We have over 25% depression, postpartum depression and anxiety rate. Actually, we don't even really have great data on postpartum depression and anxiety, which is a completely separate problem. But it's a very serious problem given that suicide, most people don't know that suicide is the second leading cause of death. Why don't we know what percent of women are affected by postpartum depression and anxiety? These are just a few examples on the outcomes side. And then on the spend side, we're spending over $10 billion a year on those neonatal ICU admissions. And that's coming ultimately from us. We are paying with our cost of health insurance for people to be going to the NICU. We should be paying that if they need it, but why do they need it? How did we create a healthcare system that delivers this poor quality of outcomes?
Yeah. Tell us a little bit more about how Almond is tackling these issues. I remember that when you're reading your bio that when you were managing some type of chronic issue and that you were in an appointment. Tell us a little bit about
that. So there are a few ways that we're working on solving the problem. I can start with some examples how the problem shows up, and I can start with my personal story, which actually started before pregnancy. Before pregnancy, it was really simple. I was actually working in a hospital at the time. I had a urinary tract infection, which anybody knows who's had one. It's very uncomfortable. You can't really work when you have a UTI.
The worst.
And I couldn't get a prescription. I was sitting in a hospital and I couldn't get a prescription. And it just made me so angry and so frustrated. And it was so common because so many people have had that experience, that you're waiting days to get a prescription for something that is really requires, not in the least because UTIs can also be life-threatening. So that was one example of how a bad experience became really personal to me. I think as I progressed through my women's health journey, there were even more examples. Something was missed early on in my prenatal care, and I ended up with a second trimester pregnancy that had a serious genetic issue. And if there had been more thorough care, we would have caught that sooner, and I wouldn't have had to have a expensive, emotionally expensive and risky procedure to terminate a pregnancy that never needed to get to that point, or maybe should have never happened at all. And it's a hard thing to talk about, and so many women don't even talk about their abortion or termination or miscarriage issues because it's so painful to talk about. But a lot of these, we need a system that helps us avoid really negative outcomes that can be avoided.
Right. I know that you had also mentioned that when you were in these doctors' offices, you felt like you were unheard, you were confused, and you'd often use Google to fill in the gaps. I'm sure most women feel that way, but Almond is trying to do something to help with better communication. I'd love for you to share how Almond is helping with better communication.
Yes. So Almond, we have 3 pillars of our philosophy. The first is making it convenient to get care. The second is delivering a hybrid of traditional ObGyn care and functional medicine. And then the third is better communication, so that when there is a recommendation made, that we as a system can actually follow through and make sure the recommendation happens as needed. I can talk a little bit about each of those pieces. I mean, the first is convenience when it comes to healthcare should just be table stakes. If you need an appointment, you should be able to get an appointment. You shouldn't have to call 20 different offices, each 3 times and wait on hold and leave a voicemail that doesn't get answered. This should be solved. And at Almond, for example, you can just come on our website and book an appointment. You don't figure out when our lunch hour is and call us at the exact right time and wait on hold. Just book an appointment if you need. Also, more examples, like how message should be text with your doctor's office. But it's not. We had to build that from scratch so that our patient can text with our team, because why should you just, So that's pillar 1. Pillar number 2 is, as a system, the way our system in the U.S. is structured, insurance companies put pressure on physicians' offices to deliver care in less and less time, and that should be. And so doctors are in this really difficult situation where they are expected to do more and more in less. Answer my question, or it's because they are under these unrealistic expectations that our system has set up. So that's one problem. The second problem is that medical training in this country, while it is great in a lot of ways, it also is slow to adapt in a lot of ways. And our physicians are not the latest research lifespan, and also a term that's been popularized in the functional medicine space, which is health span. So how many years are we spending actually feeling healthy? Seen this, very closely, watching my sisters both go through medical school in the recent years. They spend very little time on nutrition and exercise, and that's a really big problem in the United States, where we have such high rates, this is not disputed, of chronic disease. So we need to bring those two things together. We need to bring together traditional, in particular functional medicine, and improve our focus on diet, exercise, sleep, stress, lifestyle, because we have this chronic disease epidemic in this country and we need better tools. So that's number two. And I'll say Dr. Evans, our lead OBGYN, is one of the only OBGYNs in the country that is both a board certified OBGYN and trained by the Institute of Functional Medicine. It shouldn't be that way when we have 50,000 OBGYNs plus in this country. And then pillar number 3 is better communication. Doctors go through all this training, 4 years of medical school, many more years of residency and fellowship, plus any research that they've done in between. And they have all this knowledge in their head, and we get this brief period of time with them where they tell us all these things, and the standard into thin air. And maybe you caught some notes on your iPhone as a patient. Maybe you've been scribbling madly, or maybe you have a health system that's going to send you a huge packet of information, for anybody who is managing irregular bleeding, and it's 40 pages of something that's not relevant to you. So you're never going to read it. Where is personalized capturing of what your doctor is trying to convey to you? And then how do we capture the next steps that come out of that conversation and actually make sure that those next steps happen? And doesn't need to be rocket science. We are doing this in our work meetings. We are doing this in our health and fitness trackers. We are doing this most places where we spend a lot of time. It's a place where we really want to capture this information the most. So at Almond, we're building better notes and structured to-dos, structured task lists into the fabric of the way that we develop our care, because we don't want those balls to get dropped.
Yeah, you mentioned earlier 3 out of 4 women are unhappy with their current OBGYN. Now I know why. They can't communicate. The information that they receive is confusing, and they can barely make an appointment. And the doctors right now aren't, I guess, educated to the latest, modern standards, which includes functional medicine. I mean, that is really quite shocking. And I'm so glad that you're transforming this traditional healthcare model and making it come to the 21st century. Aren't you so happy?
Actually, I'm really happy about it. I don't know, maybe it sounds silly, but I go to work every day and I am actually really happy because I see the patients leaving our office, with looking around, or they'll say, I cannot believe this place is real. People will say that to us every week, and it feels really good.
So you also have a really impressive Net Promoter Score of 97. I'd love for you to tell our audience what the Net Promoter Score is and why it's so impressive to get a 97 out of 100.
We are very proud of our Net Promoter Score. I will say when we set our goals, we did not expect to get a 97. So what the Net Promoter Score is, it's a patient experience survey that was, I believe, first developed by Bain Consulting Firm, but maybe somebody will correct me if I'm wrong. And it's that question that most people have seen, on a scale of 1 to 10, how likely are you to recommend this product or service to a friend? And according to Bain's research, legend has it, this was the most accurate score to actually understand truly if somebody really liked a product or service. It was just like the best phrasing. And so it's taken hold as a standard. A lot of different industries use it. In healthcare services, so doctors providing healthcare, the average NPS score, according to a survey that Boston Consulting Group did in recent years, the average score is negative 62. So that's really, really low. And we know, that people really struggle with their healthcare experiences. So that's unfortunately not surprising. At Almond, we've asked NPS from the beginning because we really wanted to know, well, are we doing better? And we track that really religiously. Our score has been consistently really high, and we take very, very seriously when we get a low NPS score. We really try to understand what happened there and talk to individual people, because this is how we learn and continually make our service better.
So earlier you mentioned how, most doctors only have a few minutes to spend with a patient. And a lot of that is because they need to see multiple patients in order to even afford their practice. How does Almond create this space of affordability and quality and still make it really scalable? It seems really challenging.
I'll say it's hard. It is really hard because the system is not designed for us to succeed, and also to have longer visits and to have more support services. There are a few ways that we structure our business so that we can build a better healthcare service. I'll say there's a long-term view on that, and there's a short-term view on that. The long-term view is ultimately you do need to renegotiate better reimbursement rates from insurance companies. And the way that you're able to do that is if you're able to prove value to those insurance companies. So big picture, our vision is we go to insurance companies and we say, hey, patients who deliver their babies with Almond on average are $30,000 less expensive to you. And so we believe that it's in your best interest to send patients to us and also to pay us a little bit more because we're saving you money. So allow us to be viable. And there are some actually very real numbers behind this. Right now, we are working on presenting to insurance companies our model of pregnancy care, which has been shown in studies to reduce NICU admissions between 20 and 70%. And that's a big range. But even if you fall at the low end of that range and you only capture a portion of that value for an insurance company in California, that can still be worth $30 to $60 million a year. So the numbers are really big in pregnancy care because it's the number one most common reason for hospital admission. So that's big picture how you survive long term. In near term, there are a couple of ways we make it. First of all, we're venture backed. So we have VCs who believe in the big picture vision. And so they're willing to underwrite our product and engineering and SG&A costs in the short term. We couldn't do it without that. We looked into debt models of growing this business. Doesn't really net out. The math didn't work for us. And then, the other answer is we have to be really thoughtful and creative about what is the package of services that we bring to patients to allow ourselves to have the profitability, even in the short term, to allow us to succeed and continue to raise venture capital. So what you'll see in our business model, for instance, we don't, medical office visit. We also have other services that are not covered by insurance that in a sense allow us, the mix of all those services allows us to hit a margin that allows us to grow and succeed.
So From working at McKinsey to now being an entrepreneur, which is harder? What's the most challenging thing that you've experienced as an entrepreneur?
I mean, it's such a personal question, definitely not objective. I think the harder thing for me was McKinsey because it just wasn't what I really wanted to be doing and what I was loving to do every day. I loved that experience was invaluable to me. It was harder because that job was not aligned to my goals and my personal skill set. And I knew that going in. I think being a founder is, by contrast, I mean, yes, the problems are more important and they're bigger and they're harder in a sense, but I love this day to day immeasurably more than I loved that day to day.
Yeah, you can tell. I can just tell your passion. Like, I want to wake up and I want to change healthcare for women all across the U.S. and also the globe. Are you also rolling it out everywhere or just the U.S.?
We're just in the U.S. Mm-hmm. We're in the U.S. right now just because healthcare systems are so country specific. But I know it sounds odd. Maybe people listen to them, they're like, I don't know. She's like, I don't know if I believe that. And that's also fine. But I think when you're really doing something that you care about and that's aligned to your core mission, then you can feel like that. And not to say that there aren't challenges and there aren't hard days and there aren't weeks that I am, dreading a certain challenge. And those are really hard weeks. But in the net, they tend to carry less weight. I'm happy to talk through some of the challenges if that's helpful too.
Yes, please.
So, I mean, I think the first challenge as a founder in this journey was just raising money. Raising money is hard in general for startups. It's especially hard as a female founder. And I knew that going in. I still had probably a delusional amount of confidence that I was going to be able to raise a round. I went out with just a pitch deck and no service. And I was like, I'm going to raise $3 million. This is going to be great. And actually we got pretty close, but it didn't end up happening. This first effort of going out to fundraise did not work. And ultimately I got 180 plus no's on our initial fundraise before we closed our seed fundraise round. That was a long journey and it was hard. I think what I learned a few things in that experience. One is, I mean, you just have to keep trying to find somebody who will say yes. And you need to try and learn and just keep learning. And eventually it's going to work out. It just depends how long you're willing to try. I also learned it's really important, if you are fundraising at some sort of disadvantage, maybe as a woman, maybe you're fundraising in an environment that is not sexy for investors at the time. I think there are two things that really matter. One is being really clear about what value are you creating with numbers and being able to demonstrate some momentum and progress towards that goal. People want to see numbers and they want to see results. So that's number one. And number two is finding people, whoever that might be, who just on a personal level understands your product and your service and your mission. And that was something that we had to learn the hard way. We spoke to so many investors who were, from the best VCs and who were super smart individuals. But the people who ended up investing were people who were super smart and understood this service intimately. They either, some of our early investors were the founder of Carbon Health, Cesar Javaharian, or the founder of Modern Animal, Steve Edelman, or, True Ventures ultimately was our lead, and Tony Conrad, our lead investor, was, on the ground building Modern Animal alongside the operating team. He was a really hands-on investor. So they live and breathe it, and it was those people who understood, who were the first, some of the early momentum, because they really, really understood intimately. And so they didn't have the bias or the fear. Investors are just people too. They are assessing you based on their ability to build confidence. And if you don't know something, it's harder to build confidence.
Did you get money from women VCs?
We did get money from female VCs too. I should say all those people I named were close, had services experience, really forward-thinking female investors who were really good at understanding big picture market dynamics in healthcare. So the first big one was Surbi Sarna at Y Combinator. That was, she was just an incredibly, incredibly important investor and supporter, and a really smart person and great mentor. And Britt Marin at Offline Ventures. Britt is a visionary. I talked to so many investors, and the first time I spoke to Britt, there was something in her voice, and that made me think I need her to be our investor, because she has a clarity of vision and speech that was really unique, and it's served us so many times. She's really shown up for us, and she's had insight that is uncommonly thoughtful. So really appreciative to both of those female investors. There are a few others too. Those are the big ones.
I love your brand, Almond. How did you come up with the brand name?
I didn't come up with the name Almond. My good friend, Erez Cohen, who's a founder of another healthcare company, August Health, came up with it. And he's really good at naming things. You gotta sit with your friends who are smart at naming things. But the prompt when we were having this brainstorm around my living room was, let's just find a brand name that connects to our joy of being alive. And when we're having that discussion, where that takes me is into the garden. My dad is a gardener. He has in his house in Los Angeles over 100 varieties of fruit trees, rare fruit trees and not rare fruit trees. And it's just the best place to be on an afternoon, just walking through the garden and getting lost in those trees and picking the fruit directly from the branches and enjoying it in its absolute freshest moment. And when else do you feel so connected to your body and to nature than being able to become one with it? And I think that's a feeling that I would love to be able to create in our healthcare experience too. Why should we go to a doctor's office, feel disgust at the choice of the furnishings? I mean, any of that. We are doing the most important thing, which is taking care of our physical and our mental health. That should feel as good as picking a strawberry guava off the tree and putting it in your mouth. So that's really our goal.
I love it. Yeah, it feels really accessible and modern, and definitely not your traditional office OBGYN website that you see. So tell our audience how Almond works. I understand it's a membership. Is it tier pricing? Tell us a bit more about what your services are.
Yes. So in the simplest sense, we are an OBGYN office. So you need an OBGYN visit, any kind, full service from, you it's your first period, or you have become sexually active, to you are looking for some STD testing, or you have a vaginal infection, to pregnancy, to perimenopause and menopause and beyond. Actually, the recommendation is that women should see an OBGYN even post-menopausally, which most people don't know. You need that visit. You come to our website. You sign up for a visit. You select. We have a membership. We have a membership model, so you become a classic gynecology member to start. And then you actually, in our booking tool, it takes into account why you're coming in and what you need, and recommends the right type of visit for you. So we take some of that guesswork out and that mismatch out right from the beginning. You to come in for a visit, you don't need to, for instance. So that's number one. You book, you come in for the visit, and then after the visit, you get delivered a care plan in writing, and so you can see what is it that you need to do next. And then if you have questions, our dashboard is integrated directly with text messaging, so you can just text us and somebody is going to respond. So that's the classic model. But OBGYN is actually, a lot of people don't know this, it's the second largest specialty by spend in the country after only primary care. It's not some, small subspecialty of medicine. Women are recommended to go to the OBGYN at least once a year, even if they're not due for a pap smear. So a pap smear is the actual HPV test. And depending on your age and your risk factors, there can be variable timing for how frequently you need a pap smear. Just a PSA, because people don't know that. OBGYN once a year. And so on top of that, different, or because OBGYN covers such a complex function of our body, our reproductive health, there are so many things that fall under this umbrella. And what we've realized is there are so many outcomes, negative outcomes, that are common in this country that require specialized care. And I won't call out all of the ones that we focus on, but I'll call out three. I'll call out PCOS, pregnancy, and then general wellness. PCOS affects 8 to 13% of women. It's a syndrome, which a syndrome is a category that we put dysfunction that is not so cut and dry that it can be a disease or a disorder. It's like medicine's like, well, I don't know exactly what the cause is, so we're going to call this a syndrome. IBS is another example of a syndrome that affects 20% of Americans. But PCOS, because it's not really that well understood, there isn't a lot of training in medical school that really effectively treats PCOS, unfortunately. And so the experience that a lot of women experience is they'll go to a doctor, they might not get diagnosed for PCOS at all. They might be told that, well, you have painful periods, or you have some facial hair. I don't know, that's just kind of deal with it. Or the doctor might identify correctly that the patient, does have PCOS, and the very common treatment is birth control. But birth control doesn't work for everybody. First of all, it doesn't solve everybody's problem, or some people really don't want to be on hormonal birth control. And the answer that a lot of those women experience is, well, this is what I've got for you. Take it or leave it. And at least that's how patients feel. And so we take a very different approach to PCOS. We don't believe in just prescribing birth control because we see that as masking symptoms instead of understanding the true root cause of each individual person's PCOS, right? Because it's a syndrome. Different issues can be causing PCOS in different mechanisms in different people's bodies. So in order to truly treat PCOS, we throw out the prescribed birth control first as a first line out the window, and we take a step back. We do two thorough intake visits. We have one clinician. We do thorough lab testing, so more thorough than a standard OBGYN or PCP would offer. And our OBGYN, Dr. Evans, will look at this thorough intake and this lab test and really seek to understand, well, what's the root cause of your PCOS? And then we can build a personalized treatment plan for you based on that. And it will probably be a mix of diet and exercise and lifestyle changes, but that path needs to be personalized. So that's number one. And then number two, we pair those clinical visits with a health coach visit. And because what we know about hormone dysregulation is that we don't want to and we can't actually just treat this with a pill. We have to treat this through behavior. The reality of behavior change in humans is that it is harder than taking a pill. This is part of why we have a chronic disease epidemic in this country, because we have ingrained behaviors that are detrimental to us, to our health, like eating processed foods, overworking, sitting for untold hours a day, not exercising. And we don't have the mechanisms in place to counterbalance those learned behaviors. So, and you can't take a pill that solves your diabetes. So we have to find new ways to invest in behavior change and make that integral to our healthcare delivery. So that's one way we do this in this PCOS program. That's one of our favorites. The second that we're just so excited about is we released a new model for pregnancy care. It's pregnant. It works really differently than the standard model. Standard is 15 or so visits with an OBGYN. Maybe your visits are 15 minutes if you're lucky. Often they'll get cut down to 10 minutes or 5 minutes. And even if you have the 15-minute visits, what we hear from patients all the time is, my OBGYN missed this thing, or I didn't understand this thing, and my OBGYN just brushed my question aside, or I really want an unmedicated birth, and my OBGYN didn't even talk through the options with me. And it's not that the OBGYNs are bad people. They are not hurting their patients on purpose. They are under unworkable constraints. And just really a shout out to OBGYNs. OBGYNs have some of the highest burnout rates. They work some of the longest hours. It's the worst work-life balance. Like, when we talk to the kids, often say things like, yeah, my mom was not really around growing up because she was always running off to the hospital. I mean, they are expected to run a full clinic schedule and then appear at the hospital magically to deliver babies. And they actually pull it off a surprising amount of the time. But that's too much work for one person. And that's why they're burning out. And that's why we're projected to have a 10% shortfall, a shortage of OBGYNs by 2030. Nobody, it's a superhero task. So that model is broken. We know that. The group care model is 11 visits in a group, 90 minutes long each, led by a midwife. So you really get that in-depth education that you need in order you are ultimately running your pregnancy. You, the patient, as a patient, I'm actually 26 weeks pregnant right now. I'm in charge of my pregnancy. But if I'm given breadcrumbs of information, how can I be in charge? So this model gives me as the patient the information that I need. And then there are between 3 to 5 visits with an OB when needed. When you need to meet with the surgeon, the OBGYN is the surgeon, then you meet and you have those visits with the OB, not every visit, not the visit where you need to understand prenatal nutrition intimately. The best part about this model is we didn't invent this, by the way. This was invented by a nurse midwife who trained at Yale, and she developed this in the 90s. And this model has been tested extensively. There are over 100 studies on this model, and it's been shown to reduce neonatal ICU admissions, as I mentioned earlier, by 20 to 70%, which is just wild. decrease preterm birth rate, low birth weight, reduce the rate of postpartum depression and anxiety, increase the rate of breastfeeding initiation, and more. And actually, midwives are shown in studies to reduce the rate of C-sections. And so as a patient, ultimately we hear, so many people will ask their friends or will be researching for an OBGYN and they'll say, will the OBGYN deliver me? And that's just something that so many people look for. And I understand it because we're afraid. As pregnant women, we're afraid. It is very scary to go through pregnancy because you can do something that can harm your baby. Labor is not only painful, but it can be life-threatening. We are scared. One standard has been, well, at least can I know the person who's delivering me because maybe they'll treat me better. Maybe because we have a personal connection, I'm going to get better care. Like when you really take a step back, that feels really medieval. Like we're relying on our personal connection with the OB who, by the way, doesn't even have enough time to be there with us. That's our best way to reduce our fear. Well, why not look at data and actually choose an intervention that's shown to deliver us the outcomes that we're looking for? And the answer is actually the group pregnancy care isn't offered the vast majority of places, and better models are not offered. We're not, as pregnant patients, we don't become pregnant and somebody says, okay, well, here's this model that an anxiety rate and your chance of, very serious mental health issues, and this model that decreases it less. Nobody is giving you that menu. And what we're striving to do is to give patients that menu.
Well, I love that because I think community and belonging really helps avoid loneliness, which happens a lot, especially when you feel so alone during this pregnancy journey. And you have that as well, and then you have the knowledge and people can, pregnant moms can bond. That is amazing. I wish I had that.
I mean, this is exactly true. And it's like, when we think about it, you're like, oh yeah, pregnancy is so complex. We do need a community. Wait, isn't that how we did pregnancy all along? Why are we trying to treat pregnancy like it's as simple as taking a pill? It's not. It's integral to transformation that should be the standard again. I mean, it once was part of the standard, this community. And the research backs it up.
Wow. So congratulations on your pregnancy. So how do you manage it all as a CEO? And is this your second or third?
Yes.
Second?
Yes.
How are you handling your self-care?
I have to say it doesn't work without help as a CEO. I'm really lucky to have an incredible support network. We have a nanny, a full-time nanny, she's part of my team. And if she's not so excellent, I would not have the bandwidth to do what I do. So that's number one. My parents are here and my husband's parents are here in LA. And I think that they spend less time with my 2-year-old, but it's really important time. And as a mom who's working a lot, it really alleviates the stress that I could be putting on myself, the guilt of, well, my daughter, she is my number one priority still. My family is my number one priority. And if I didn't feel like she could get a rich buffet of love from all these different people in our life, and if she depended more solely on me as a mom, maybe the guilt would be too much and I wouldn't be able to do it. So I feel so grateful to have grandparents. And then, people say this and it's very true. You focus and you get better at prioritizing. I work slightly fewer hours. I used to work I probably worked from 8 a.m. till 7 or 8 p.m. before I had a toddler, and I cut it down. I want to stop working and so I can see her. So I try to stop working at 5. Some days I'm more successful than others, but those extra hours mean a lot, and it's something that I feel good about and that I can balance sustainably.
Incredible. And the fact that you're even open to receiving help, because a lot of times women are just like, I got it. Like, no, you don't have to ask for help. Yeah.
Yeah, no, it's so true. Yeah, it's hard to ask for help.
Yeah. What advice would you give to aspiring entrepreneurs now that you've gone through this journey of raising money, having this incredible business?
I'd say first, just to have a point of view. It sounds obvious, but think about, there's so many ways that you can make an impact in the world. Choose one that really matters to you and have a unique point of view on it. This is the advice that I got early on in my career from a VC. And I think it sounds obvious, but a lot of people build businesses or are looking to build businesses and don't actually yet have a strong point of view. Just never give up. It's very true. This is finding a way, and I don't mean never give up in the sense that, work yourself despite being miserable to your bone, but find a way to tap into the resilience inside of yourself so that you can give your best energy for as long as you can. And it's not about gritting your teeth necessarily. It's about knowing yourself and surround yourself with great people first and foremost. I mean, it's interesting. YC doesn't even or rarely invests in solo founders. And there's a logic there. We are social beings. We do better work in teams, and the quality of that team matters. It's the number one, I believe, in the early stages to building something that has a chance of succeeding.
I really love hearing about your story, and especially because you actually was you were the founding manager of an internal tech incubator, and you actually help grow companies, help raise money for these companies, help them with the MVP. And then when you went through it too, you were like, oh yeah, I'm going to get funded. And no, I'm going to get 180 no's. And it is so inspiring to see someone who's out there doing something and making a huge impact for women in healthcare where it's so needed.
Thank you.
Yeah. What's next for you?
We're going to grow Almond, and we believe that every woman in the country should have access to better ObGyn care through Almond.
How do listeners go to learn more about Almond or connect with you?
So you can learn more about Almond on our website, almondobgyn.com. Our core gynecology service is available, and our pregnancy service is available in Los Angeles right now. In the state of California, we have our PCOS program available everywhere in the state of California. It's a telehealth service. And then outside of California, if you are looking for just a better baseline understanding of where do you stand in your health and how do you get health coaching support, you can take in the next week, this will actually be released, our health assessment lab testing service. So we'll run a bunch of baseline labs, and you can take those labs, and then you'll get a personalized assessment that points out how are you doing and what are the big interventions that you can make in your health, and then you can pair up with a health coach to help make those interventions. And I'll say at least the sign-up list will be released in the next week, depending on how that sign-up list fills up. We will decide how we take on patients. We've seen there's a huge amount of demand for this. So anybody in the U.S. can sign up for that.
Amazing. So almondobgyn.com, is that the same also in social media?
And then on social media, our handle on Instagram is almondobgyn. We're also on TikTok. And if you want to reach me, you can DM us through Instagram, and your message will make its way to me.
Awesome. It's been such an incredible time speaking with you. Thank you so much for inspiring us with, creating such an incredible company. I'm sure that everyone who's listening got a lot of insight into this terrible maternal health crisis that we're experiencing. Had no idea that the U.S. had the highest mortality rate. And thank you so much for doing all that you can do to address it.
Thank you so much for having me.
Thank you for joining us on the EO Wonder podcast, and hope to have you back on the show when you have more success.
Great. Cheers to that.
Thank you.